which we are going to is about fatty liver. And to discuss this, we have with us eminent gastroenterologist, Dr. Vidya Sagar, sir. Welcome, Dr. Vidya Sagar. Uh, to,
Thank you, Dr. Vikram.
to start off our discussion on fatty liver, I just want to bring out a very recent experience I had. One of my friends in my apartment, he's only 40 years old, and he just went for a routine uh, checkup, health, the package test, and he found that in ultrasound he had fatty liver. He doesn't drink.
Mhm.
Uh, he does regular exercise, and he found fatty liver, and he was very surprised, and he came to me saying, "Doctor, I don't drink. How can I have fatty liver?" And what he surprised was when I told him that this fatty liver is pretty common today. So, with that background, we'll understand more about this fatty liver, whom it comes, and how do we manage and diagnose. So, to set the ball rolling, sir, what exactly is this fatty liver disease, and how does this fat build up in the liver if it's so?
Okay. See, as the name itself indicates, fatty liver is nothing but excess amount of fat in the liver. So, is there a defined quantity of fat one can have? So, normally, liver cells store a little bit of fat, but we say anything less than 5% of the liver should be containing fat. Anything more than 5% deposition of fat is called as fatty liver. So now fatty liver can be in a wide spectrum. It can just be fat without causing any harm. We call it as fatty liver, or in medical terms, steatosis. Sometimes this fat in the liver can cause irritation, injury to the liver cells, and this is called as steatohepatitis. That means injury to the liver cells. And this can be notoriously silent. Sometimes it may be picked up on the blood test with abnormal liver chemistry, sometimes not. And at the extreme, whenever there's continuous injury and healing, a lot of scar tissue accumulates and causes severe scarring called as cirrhosis. This is the spectrum of fatty liver. So to answer your question, what is fatty liver? Anything more than 5% of fat in the liver is fatty liver. It is nothing but cholesterol that is produced in excess, gets deposited in various tissues in the body. When it is around the belly, we call it as obesity, or around the body. In blood, it is called as cholesterol. In the coronaries, it causes coronary artery disease, and so on and so forth. When it sits in the liver, it causes fatty liver. Just to keep it extremely simple for a common understanding.
Perfect, sir. I think that made it very easy for us. But as I said, in my friend who had fatty liver, he doesn't drink alcohol. He's slightly on the obese side. But who are the patients who are the people who are at risk of developing fatty liver disease? Is it a myth that it develops only in patients who drink alcohol?
Okay. Good question. Many people have these kind of common misconceptions or myths that fatty liver, yes, it is common, it is harmless. I've had it for many years when I go for my health checkups. It's seen in commonly people who take alcohol. No, fatty liver, yes, alcohol is an important contribution for fatty liver, but alarmed or I'm alarmed to see that the fatty liver prevalence is increasing day by day in the population. Previously, it was around 25-30%. Now it's almost 40% in urban societies. And most recently, there was a newspaper article quoting 40% prevalence of fatty liver in the society in Bangalore. So, and I talked to you about what fatty liver is. Now, is it only limited to alcohol consumption? The answer is no. Is fatty liver, what is the reason? Yes, these days we have the modern epidemics of obesity, diabetes, and other diabetes and obesity related problems like dyslipidemia, that is high cholesterol. All these things leads to the fatty liver. They're all interconnected.
Sure, sir. So it's more of people who are having multiple comorbidities like obesity, diabetes, cholesterol, not only alcohol, which can be at risk of fatty liver. But
Correct.
suppose somebody has fatty liver, should they be really concerned? How serious is this fatty liver disease? Can it be life-threatening if ignored?
Fortunately, fatty liver is not a serious in majority, but it has a potential to be a serious. So one should be aware. So I'm choosing my words very carefully over here. It is a silent disease, just like diabetes. About 30-40 years ago, diabetes was very uncommon. Say in a colony or in a road, only one household would have had a patient with diabetes. But now every household is having. Now, this epidemic has also spilled over into fatty liver. We see that every diabetes is having a fatty liver. About 60 to 70% of the people with diabetes, or even 85% in some series, have fatty liver associated. Obese people, 70% have. Even lean individuals, you talked about your person, your friend who had a general health check, was very lean, was doing regular physical activity, was not drinking alcohol. So lean people can also have fatty liver. So, and it is a silent killer, and it is growing in alarm proportions and epidemic proportions in the society. So one should definitely, healthcare professionals as well as the public should be aware, because this is a modern day epidemic.
So point well taken, sir. People who are diabetic, obese, drink alcohol obviously have a high risk, but even patients who are not obese can also have fatty liver. And
Correct.
good thing is it is not very serious in majority, though it can turn serious in some patients.
Correct.
So, as in my friend who just happened to find that he has fatty liver disease, is there any early warning signs of fatty liver, or is it usually like this that it is silent?
Yeah. So this is where the most difficult aspect for a clinician or a doctor to decide which is the person who will fall into the majority category of, non-progression, remains as a fatty liver for the rest of their life. Who is the person who's going to progress into some sort of a serious liver problem? So sadly, we don't have any early warning signs in fatty liver. So everybody who has been diagnosed to have fatty liver based on a general health check or an ultrasound, or someone says, hey, you are a diabetic, you are obese, get yourself checked out and gets to know a diabetic, ought to be risk stratified. So someone, when they are diagnosed to have fatty liver disease, they have to be risk stratified into two main things. One is risk of the liver and liver related problems, and risk for their metabolic problems such as diabetes, heart risk, stroke risk, cardiac risk, kidney risks. So one is metabolic risk profiling, and other one is liver risk profiling.
I think we just lost Dr. Vidya Sagar there. Sir, can you hear us?
Hey, I'm there.
Yes,
Yeah,
yes.
yeah, I can hear you.
Yeah, we missed a little bit of the last part, sir.
So yeah, basically, are there any early warning signs? Sadly, no. So anyone who gets diagnosed ought to be mainly risk profiled, mainly for the liver as well as the metabolic complications that may be associated with fatty liver.
Sir, my friend found out he has fatty liver on ultrasound. So, is this the only way to diagnose fatty liver, or are there any other blood tests or any other methods to detect fatty liver and how's the seriousness of fatty liver?
See, fatty liver, the simple basic test to diagnose fatty liver is mainly by means of an ultrasound. Um, so you have other advanced modalities such as a CT scan, you have MRIs and other things, but applicable to a general population, which is cheap, which is reproducible, which is can be affordable by the large majority of the population, is an ultrasound. So yeah.
So, is it prudent that somebody who is um, he's obese or drinks alcohol, who has comorbidities like diabetes, high cholesterol, should get their ultrasound checked, or is it based on any other parameters like if they have, even if they don't have, should we do it? So, is it for everybody that we should do an ultrasound? Because that is probably the easiest way to pick up fatty liver.
Yeah, I think we will be opening the Pandora's box if we start doing ultrasound scans for everybody. But yes, to begin with, we should start focusing our attention to high risk individuals, meaning individuals who have a strong family history of metabolic or cardiac risk factors like family history of hypertension, diabetes, heart diseases, strokes, people who are obese, people who are already having these kind of cardiometabolic illnesses such as blood pressure, diabetes, obesity, dyslipidemia, that is high cholesterol, are the ones who should be screened for fatty liver disease, because 8 out of 10 people will have fatty liver disease. So the common myth is that when fatty liver disease, people start coming to the gastroenterologist worrying about, oh, what's going to happen to my liver health? But it's the other way around. About the risk to the liver progressing into cirrhosis of the liver is only 6% probability. But a person with fatty liver develops 60% risk of metabolic complications such as diabetes, cholesterol, heart problems, strokes, and even sometimes cancers. So there's a 60% probability. So the risk is mainly more on the metabolic rather than actually the liver.
So if you are found to have fatty liver, I think your concern should be whether you have other problems associated, other than
Correct.
fatty liver itself progressing into
Yes,
cirrhosis. So probably that's what I understand from that.
that's
Uh,
correct.
so, sir, we talked about what is fatty liver. We talked about who are at risk of fatty liver and how do we diagnose fatty liver. Now, once we somebody has picked up, like my friend now, he's found to have fatty liver. What is the treatment modalities available? Is it medication, diet? Uh, what can he do?
Okay. So before I answer that question, once someone's been diagnosed with fatty liver, one has to ascertain what is the reason for this fatty liver. So the most commonest what we see in the day-to-day society is non-alcoholic fatty liver disease, or the new nomenclature is MASLD, that is metabolic associated steatotic liver disease, MAFLD or MASLD. Of course, other minor contributors would be one, certain medications, like in your rheumatological practice, there are certain medications like steroids, methotrexate itself can cause fatty liver disease. There is certain metabolic conditions that affect the liver called as Wilson's disease that can also present as fatty liver disease. People on hormonal pills can develop fatty liver disease, and so on and so forth. And of course, alcohol. So one has to take a careful history to rule out other things. So when someone is obese, diabetic, and having all these other metabolic these factors, the key or the cornerstone of treatment for fatty liver disease is weight loss, exercise, making healthy choices in diet, and disciplined lifestyle and disciplined eating. And of course, people who drink alcohol should be advised to curtail on the alcohol. And we've alluded to this in our previous talks as well.
So
So
this is
this is
very
the
difficult to
cornerstone.
do for patients. Just to interrupt you, patients will say, "Sir, this is most difficult to do."
Mhm.
You're telling about lifestyle changes, weight loss, exercise, dietary changes. Um, Patient says, "Sir, give me a pill." What do we do about it?
Yeah, I'll just come to that pills. See, when I say lifestyle, it means a style for life, not for New Year's resolution, not for getting into shape for a summer holiday or your birthday or milestones kind of things. So I think it's mainly about our discipline, our habits. We
Yes.
spend a lot of time at work and other things. We just need to spend that extra half an hour to 40 minutes every day. So 30 minutes of walking, 10 minutes of resistance training in the form of either yogasana, some weight training, dumbbells, or even push-ups, pull-ups is all that is required. So olden days, people used to walk, cycle, cut logs, draw water from the well, lift heavy objects, and all these things. This itself caused uh, much of the weight training and your aerobic, anaerobic exercises. So at least spend half an hour to 40 minutes in that way. And of course, portion control, disciplined eating. I know these are all the difficult aspects, but this is the cornerstone. You talked about a pill. Now, there are pills to protect the liver from the damage of fatty liver. There are pills to achieve weight loss, and pills to, medicines to reduce the risk factors such as for cholesterol and heart problems and diabetes, etc. So these are the various treatments. Now, to protect the liver, there are only certain things like vitamin E. There's a molecule called as saroglitazar. There's certain other fat loss medications that can be used to protect the liver. For weight loss, you might have heard, and lots of people and the listeners would be aware of medications like semaglutide, liraglutide, tirzepatide. These are the Mounjaro and Ozempic and Wegovy, which are fat loss. Basically, they work on certain hormones and chemicals in our body, which suppresses our appetite. And therefore, chemically, it forces a person to have reduced eating, reduced craving for food, and reduced portion eating, and therefore weight loss.
Fine, sir. So the take home is obviously just the lifestyle changes,
Correct.
style of life, which has to be changed, and some liver protective medications as well as weight loss medications. But the focus is only on lifestyle mainly, predominantly.
Correct. Correct.
One thing probably which when we are discussing about the cause of fatty liver, which came
Mhm.
to my mind is fatty liver only something which adults get or even children develop fatty liver?
Okay. Uh, Interestingly, pediatric fatty liver disease was uncommon, but now with the kind of the dietary factors, lack of exercise, we are seeing an alarming proportions of fatty liver even in pediatric populations. So
Hmm.
it is not restricted to adults, but it can occur even in children. And most of our pediatrician colleagues, pediatric gastroenterologists are also worried about the increase in the incidence and prevalence of fatty liver disease
Hmm.
amongst pediatrics.
But that sounds ominous actually. Sir, now that somebody has fatty liver, we have discussed what are the treatment modalities, focusing on lifestyle and certain medications. But can it be reversed? If somebody has developed fatty liver, can it come back to normal? Can the liver become normal like before?
Absolutely. Before the damage can happen, fatty liver can be completely reversed. As I alluded earlier, liver is allowed to have around 5% of fat. Anything more than that is fatty liver. Now, there has been studies to demonstrate that weight loss by whatever means, by exercise, by dieting, or even medications to achieve weight loss or bariatric surgeries, um, helps to achieve weight loss, will lead to a significant reduction in the liver fat. So if you aim for a 5% weight loss from your present weight, if you're overweight or obese, if you achieve a 5% weight loss, it can lead to a significant reduction in the fatty liver. But your risk factors for your hypertension, diabetes, cholesterol do not go away. If you reduce 10% of your current weight loss, your risk, the fatty liver disappears, and your cardiometabolic risk factors also reduce. And this, the hard part is to sustain this kind of weight loss. So yes, before scarring can happen, the weight loss has a profound effect on the reversal of fatty liver.
So somebody who has fatty liver, they have to focus on weight loss and sustain that weight loss along with the management of other comorbidities, which can
Correct.
lead to the reversal of fatty liver. So that's a very good news. That's a very happy news about somebody who has fatty liver. I think I'll tell my friend that focus on weight loss and lifestyle changes rather than any other fancy stuff. Uh,
I
sir,
would
what
like
are
to
the yes, sir, please go ahead.
Sorry. I would also like to add, see, we also alluded there's a subgroup who are lean people who also have fatty liver. They were asked, how much more weight do you want me to lose? We are not focusing only on weight, but we also focus on burning that excess fat that is deposited in the liver. So it's making your muscles work. If you diet and don't do exercise, what happens? Along with the fat loss, you will also lose muscle. The muscle is the biggest fat burner in the body. So along with whatever mechanisms of weight loss, you have to do exercise, make your muscles, which are the furnaces in your body, to burn that fat. So that's the key message.
Fine, sir. Point well taken. Use your muscles. That is a furnace to burn your calories and to and not just weight loss, but it also with exercise. Uh,
Correct.
that's a point well taken. We have some very interesting questions coming across. We will take one by one. So may I ask, can fatty liver cause fatigue, brain fog, etc.? Does it have symptoms like fatigue, etc.?
Fatty liver per se does not cause, but of course, if you look at the chemical milieu in our body, when someone is obese, someone has insulin resistance, someone has diabetes, there's a lot of chemicals which can affect the way how our brain processes signals and other things. So yes, when you have obesity, it also comes with a condition called as obstructive sleep apnea. So people will have snoring, disturbed sleep, high carbon dioxide levels, low oxygen levels. This itself can cause lack of focus, brain fog, easy somnolence, a lot of things. So indirectly, but not directly, it can cause these kind of associated symptoms.
Well said, sir. So, one more question from Pramila. How do different diets like keto diet, Mediterranean diet impact fatty liver? And also, an extension of this is fasting, like intermittent fasting, helpful or harmful to fatty liver? So, the diet basically, what diet is helpful and is fasting helpful or harmful?
Okay. See, intermittent fasting off late, many people are practicing, and this is an age-old tradition. Say during the month of Ramadan, during month of leading up to Easter, Lent, or during the Hindu festivals of Ekadashi, all these vrats and everything. This is nothing but an impromptu way of doing your intermittent fasting and breaking the fast and taking limited portions. So certainly it gives the liver a little bit of time to relax the chemical processes. So yes, intermittent fasting, and there's adequate data to show that it is useful in achieving your metabolic targets, weight loss, as well as maintain your the goals of your metabolic goals as well as the weight loss goals, and also better glycemic or sugar control. Um, Keto diet, yes, it basically gives you a high protein, high fat, but very low carbs. There are some fallacies, but to sustain on a keto diet, it's going to be difficult because you'll run into certain nutritional problems. So always seek an expert dietary advice or speak to your doctor before embarking on a keto diet. But for short periods, yes, it is okay. But long periods, it's not sustainable because you develop certain nutritional difficulties. And any other forms of dieting you asked me? One is intermittent.
Mediterranean diet. I mean, that is an
Ah,
anti-inflammatory diet. So,
yeah,
yeah.
yeah. Mediterranean diet, yes, certainly there's a lot of data, medical data to say that it is beneficial, but it's very difficult to follow. But it's because of the kind of variety. But yeah, I mean, in terms of the money that needs to be the purchasing for the investing on the Mediterranean diet, eat what's locally available. Eat a balanced diet. That's the key, and of course, make your muscles work. So Mediterranean diet works. Your local diet also works. Intermittent fasting works. Keto diet, not in the long run.
I read somewhere probably that diet should be regional, seasonal, and traditional. I mean, that probably is what is been going on traditionally and available for that particular season
Yes,
and available in that particular region, which probably is rather than some fancy diet. So I hope that also
very true.
holds good for this.
Very true. Regional, seasonal, and that's very nice.
Traditional.
Yeah.
Yes, sir.
Well said. Yeah. And
Yeah.
tradition. Yes.
One more question is one of the from Apurva. She says that in roadside, all this everybody is selling is herbal products, and these herbal products do they also affect the liver and kidney in certain way for weight loss and
See,
so many other indications.
yeah. See, I'm not a specialist in that field, but there's a lot of data about and case reports, case series that many of these unscrupulous sellers of saying that who say that take this herbal, everything's natural, and this is going to help you with your liver health, achieve weight loss, etc. It has to be taken with a lot of caution. Never ever experiment those kind of things. 8 out of 10 people may get away without any major problems, but liver is a sort of a chemical factory. It processes all these kind of so-called herbal products, or but some people may get toxicity because of that, because the liver reacts in a bad way. So I don't recommend it. But yeah, always consult your doctor before embarking on these kind of therapies.
Perfect, sir. One more question from Bairam. I think we've already answered. What's the connection between fatty liver, diabetes, and heart disease? So maybe you want to re-emphasize.
Yeah, I think just to keep it simple for a common person or the lay listener, it is fat in the wrong places. when there's a lot of data saying that pancreatic islet cells or the pancreatic cells are being replaced with fat, that can lead to a fatty pancreas and increased risk of diabetes and so on and so forth. When it is in the circulating in the blood, it is nothing but dyslipidemia or cholesterol. When the same cholesterol gets deposited in the coronaries, it can lead to coronary artery disease. In the carotids, it can increase your risk of strokes. When it is in the peripheral arteries, in the brachial or something, it causes stiffened arteries and hypertension. When it sits in the fat, in the liver, it's called as fatty liver disease, and it can injure the liver for some people. So I think it's one single issue in different avatars or forms, just to, in a simple, understandable context for the common man.
Yes, sir. Very well put. Same culprit in different places, hiding in
Yeah.
different areas, causing different problems. Uh, Before we wrap up, sir, what are the three common myths you feel about fatty liver which you come across in your day-to-day practice?
Yeah. First of all, people assuming that, hey, I've had fatty liver for on every annual health scan, I get a fatty liver told, and so for all my liver function tests are normal, so I don't have to worry. No, it can be notoriously silent. The blood test will not give us any warning signals. And we've seen people who had fatty livers for years and decades together, finally, come for some sort of a surgery like a gallbladder surgery, hernia surgery. And when the surgeon operates, he sees the liver looks very abnormal, cirrhotic liver. And they say, I've had only fatty liver, but now it's turned into cirrhosis over a period, and it's a silent. And all throughout the blood test may be normal. So, assuming that they are in the green zone just because fatty liver is there and the liver chemistry is normal, doesn't it? The liver chemistry does not tell us anything. So that's one thing. And detection of this scarring is also very difficult to pick up. So there are different kind of modalities of investigation like fibroscan, elastography, liver biopsy, which can be used to screen these high risk individuals and pick them up and alter their course of liver health. The second other myth is, yeah, it's only in alcoholics. No, it can occur in non-alcoholic, and therefore that bigger entity, what you call as non-alcoholic fatty liver or metabolic associated fatty liver disease exists. Three, it doesn't occur in lean people. No, it is also seen in lean people. Four, it is more common in men when compared to women, or women when compared. There's no gender bias. It affects both men and women, and pediatrics, of course. So these
Yes.
are the common myths.
So, do not uh, take fatty liver lightly. It is a silent disease, so, and it can end
Correct.
up in damage or cirrhosis. What cirrhosis means? A complete damage to the liver failure, which the
Correct.
blood reports may not pick up. So that's something which we should keep in mind. Don't ignore fatty liver. You will have to consult a specialist who will assess the fatty liver, the chances of progression, monitor it, and suggest appropriate management, which mostly in most cases is lifestyle, but there are also, depending on the severity and progression, need for other medications as well. So before we last 2 minutes, sir, few take home messages, something for people to take home. Remember from this talk, if there are few points which you say, please remember this if you have fatty liver.
Okay, first and foremost, fatty liver is common. 4 out of 10 people in the society have it. Fortunately, majority don't develop liver disease. Only 6 out of 100 develop liver disease, which is significant like cirrhosis. And it is preventable by altering your lifestyle. 60% of these fatty liver can develop other metabolic problems like heart disease, blood pressure, cholesterol, strokes, and diabetes. So the risk is more. Fatty liver, you don't have to run to a specialist. Your family physician can risk stratify you. Yes, if you've got fatty liver, all your physician or you have to request your physician is, hey, what is my risk of diabetes? Do I have cholesterol? Am I overweight? These are the only things. If you have a family history, if you are obese, you know what to do. If you are already diabetic, you know what to do. The key take home message from anything is make your muscles work. If you are overweight, especially abdominal girth, get that down, because that abdominal fat is what processes everything and makes bad things happen to our body. So lose that belly fat. 30 minutes of walk, 10 minutes of resistant training, 7 hours of sleep minimum, disciplined eating, and portion control.
Perfect, sir. Thank you so much for simplifying, demystifying, and unpacking fatty liver for us. I think all our listeners will be very wise and be hitting the exercise as soon as we finish this talk.
Yeah.
Thank you so much for taking time
Thank
and
you.
discussing fatty liver with us. Thank you, Dr. Vidya Sagar. Thank you, all the listeners, for putting in the messages and asking the questions. If any further questions, please put it up. We'll take it up with Dr. Vidya Sagar. With this, we'll end this Facebook Live and hope to catch you up next month. Thank you all. Thank you, sir.
Thank you. Thank you so much. Thank you.